Hello. Like most or all of you, I have never given birth, so I cannot speak on the grounds of my own personal experiences with it. However, I can touch on values that I resonate with it. I believe in liberty and freedom of choice within boundaries, and I believe in safety and sacrifices people have to make to sometimes protect others. So when it comes to the place of birth debate, I place my values and opinions on finding a balance between a woman's freedom of choice while also considering safety and well-being factors. This may include making sacrifices for your child even when it makes you uncomfortable. Allow me to start this speech off with a short anecdote to spark your opinion and thoughts. So, Mary is a first-time mother pregnant with twins. She plans on having a home birth because she does not trust doctors to give her the best birthing experience. Her OBGYN recommended an obstetric birth in a hospital would be best due to her circumstances. She is a nulliparous woman with multiple fetuses, but she holds to her wishes of a home birth. When she is in labor, her midwife first delivers a healthy baby boy, but notices that the second baby comes out silent and blue. The mother is scared, and the midwife does not have the means to revive this oxygen-deprived baby. The midwife calls the ER, and the ambulance is sent out. However, by the time the ambulance arrives and transports the baby to the hospital, the baby has been deprived of oxygen for too long and is now brain dead. Although fictional, stories like Mary's are not uncommon. According to a study published by the New England Journal of Medicine, they documented that planned out of hospital births had a 3.9 out of 1,000 perinatal deaths compared to the 1.8 out of 1,000 perinatal deaths in planned in-hospital births. Although the overall risk of death in both settings is relatively low, out-of-hospital births are 2 times more likely to result in adverse complications, such as infant death. There is a need for a new policy regarding the freedom of choice for pregnant women on where they should give birth in order to prevent avoidable deaths of mothers and/or infants, similar to Mary's story. The current policies and recommendations in place in the United States appear broad and somewhat confusing. There are ambivalent sources and physicians that have opposing views on the safety and benefits of home birth, and even if women should have the choice to decide where they give birth. A policy that should be implemented in the United States and any other developed country is one that is collaborative, unique to women, and one that allows choice. So first, collaborative. Physicians, nurses, OBGYNs, and certified nurse midwives have a duty to serve, protect, educate, and advocate for their patients, and I believe that includes creating a personalized plan that are tailored to that individual woman. These healthcare providers need to work as a team to develop individualized procedures for that expecting mother. Such plans would include the location of the delivery, either home, hospital, or birthing ward, who will aid in delivery, and the extent to which medical procedures and prescriptions will be used, such as like an epidural. Each provider has special roles that, when used together, can create a safer and more enjoyable birthing experience than that of what currently exists, so like the broad and basic policies. One way to implement a collaborative approach is that when women find out they are pregnant, she should schedule an appointment with her OBGYN. At this appointment, the OBGYN would assist the woman in creating a team, so a physician in a hospital, a recommended certified nurse midwife for a choice in a respectable hospital that will educate and guide the woman. So the second part to this policy is being unique to the woman. So not one pregnant woman or pregnancy is the same. So why should there be a one-size-fits-all approach to labor and delivery? Elaborating further on the collaborative policy for birth, the group of physicians, gynecologists, nurses, and CNMs would take time to assess and get to know the expecting mother so that they can best serve her. In this policy, the healthcare team would review multiple factors that would need to be considered and then collectively communicate the most fitting recommendations for that pregnant woman. So some factors would include 1, whether or not she has given birth before. The UK's birthplace cohort study shows that it has been proven safer by 4 adverse outcomes for nulliparous women to give birth in a setting where medical supplies and providers are readily available, so like a hospital. 2, previous or current health conditions that could complicate the delivery. 3, distance to the nearest hospital equipped to deal with potential neonatal complications. So if a woman is more than 15 to 30 minutes away from a hospital, it should be recommended that she gives birth in a hospital in case of the need of transport. And 4, cost of delivery. The woman's team needs to consider cost and insurance when coming to a recommendation. If the woman's insurance covers a hospital birth and not a home birth, and therefore it would be cheaper to deliver in a hospital, then that should be considered if financial needs need to be considered. And the third aspect of this policy is choice. After hearing of the healthcare team's recommendations for a woman's place of birth, she should ultimately have the decision to choose where she delivers her baby. Our country is based on freedom and liberty, and that includes a woman's freedom to decide where to deliver a baby. Because pregnancy and delivery are so personal and intimate, women should not be bullied or coerced into a decision that they are not comfortable with. Going off of that, a woman should strongly take into consideration the recommendations of her professional team because their suggestions are based off facts and safety for that one specific person. While women should have the liberty to choose, they also have a duty to their unborn child to protect and advocate for them. For example, if a woman is against hospital birth and strongly wants a home birth, yet the professionals in her healthcare team recommend a hospital birth because they anticipate complications, that mother has a duty to put aside her wants for the safety of her baby. If a woman cannot make a sacrifice now to keep her baby safe, how will she take on the lifetime duties and sacrifices required to raise a child? In terms of practicality, in order to make this collaborative and individualized policy work, it needs to become the standard in the United States for childbirth. To do this, doctors, nurses, and midwives must learn to work together, respect each other, and find a way to collaborate for the health and safety of the mother and fetus. Pregnant women must take the first step in booking a consult or appointment with their OBGYN, and then they must be open and willing to work with the healthcare team. This healthcare team has a duty to put aside their personal beliefs and opinions and create a birthing plan that is best suited for that specific mother. This new policy could save lives and prevent adverse complications due to child delivery because it would combine the recommendations of professionals. For example, where it is safest to give birth, which setting would be financially best, and who should be involved. And it would combine the preferences and beliefs of that pregnant woman and her family. In conclusion, while studies have shown that there is evidence to suggest that nulliparous women have a greater chance than multiparous women of having complications during childbirth, during home birth, the differences are slim. That being said, the goal of pregnancy and birth should be to deliver a healthy baby so that he or she may start his or her life on the best foot possible. In order to do this, doctors, midwives, nurses, and OBGYNs and expecting mothers must collaborate and take necessary time to create a birthing plan that combines the woman's preferences with the doctor's recommendations. I believe that this collaborative and joint policy has the potential to reduce risk and the number of complications and deaths in pregnant mothers and their babies. Thank you.